The conventional way to make medical images is to obtain some data from a scanner and then to convert this data into medical images using an algorithm, a reconstruction algorithm that is reasonably simple. However, those imaging exams have a limited duration in time, and it would be more efficient during that limited duration if we could get parallel streams of information coming in. Of course, we still want the data from the scanner, but in addition to that, we would want data from a complementary array of sensors. And then to treat this diverse collection of data, we need a more complicated algorithm, and that's where machine learning comes into this project. And the goal is to get images that are better or enhanced in some way. The most successful sensor we've developed so far is ultrasound-based. It has at its heart an MR-compatible ultrasound transducer enclosed in a 3D printed capsule, which occupies a patch of skin about 9 square centimeters in size, and its height or profile is about 1 centimeter. We named it an organ configuration motion sensor, so OCM. To apply it is easy, as you can see in this video. One just presses it onto the skin and give about half a turn to the lid. That pushes downward the transducer for better acoustic coupling. And as you can see, it's reasonably solidly installed. It gives a signal which is exquisitely sensitive to internal motion. It generates an ultrasound field which is on purpose not focused. We embrace the fact that there might be multiple reflections. What we want is for the returning signal to act as a unique signature of the current configuration of organs inside the cavity. Our current prototype allows us to use up to 4 different sensors at a time, which can be placed at different locations on the torso for distributed sensing. So the general idea is that 1 or more sensors are placed on a patient, and then they accompany him or her to an imaging exam. And at this point in time, we now have separate streams of information coming in, and the goal is to have a machine learning algorithm that interprets these streams of data. I'll talk about 3 different examples or ways of doing that. In the first one, the sensor data and MRI are acquired at the same time, and an algorithm, in this case based on kernel density estimation, learns how to convert the sensor signal in synthetic MRI. So we have 2 slices acquired here, a sagittal and a cornal, and the temporal resolution of the acquired MR imaging stream is relatively low. In contrast, the stream of synthetic MR images has higher temporal resolution, and that's because in its reconstruction, it combined information both from MRI and from the sensor, and it was reconstructed at the high temporal resolution of the sensor data. And the fact that the synthetic MRI stream has higher temporal resolution can be observed from the fact that the breathing motion is more smooth and more realistic. Having higher temporal resolution can be useful, for example, in applications where one wants to track the anatomy as it moves, as in ablation, tumor ablation applications, for example. Once the algorithm has learned how to convert sensor data into MR-looking like images, and that the patient comes out of the scanner, there's no reason to stop generating images. We still have the sensors in place. We now know the correlations between sensor signal and images. So we can continue generating images of someone who's not in the scanner anymore. And now this ability to make images can follow him or her and the sensors all the way to maybe another imaging exam like PET or ultrasound. And we hope that this capability can help merge images from different modalities in ways that take internal motion into account. In a second application, we placed a couple of sensors over the heart, and the rest of the hardware that you see here are product MR-compatible ECG leads. Now, electrocardiogram signals are useful in MRI because they allow the scanner to time or synchronize its data acquisition with the beating motion of the heart. And of course, that's very useful in cardiac imaging, but that can be useful in other applications also. For example, to avoid artifacts associated with the pulsatile nature of blood flow. However, ECG signals are not available on the fanciest, most expensive MR scanners out there, the ones with the highest field strength of 7 Tesla or beyond. And that's because a high field causes artifacts that overwhelm the ECG signals. However, OCM sensors are essentially impervious to magnetic fields, so they could act as a surrogate to ECG leads, especially on those high-field, high-end MR scanners. Now, the last application that I wanted to present, a convolutional neural network is used to convert the sensor data into tracking information. Now, there's a lot of information on this slide. We'll take a moment to go through it. The black rectangular shape represents the gel that we were using for this experiment, and the imaging probe of a clinical ultrasound scanner was sending ultrasound energy, which was listened at or spied by one of our OCM devices, which is a little green disc in this display. Now, as you can see, the spied OCM signals are very sensitive to the position and orientation of the probe on the gel, and we developed a convolutional neural network to convert that information into tracking information, which is shown in green in the video. Meanwhile, the imaging probe was also being tracked by conventional means with an optical tracker, and the position and orientation of the imaging probe, as seen by those cameras, is shown here in yellow in the video. So when our algorithm made small errors, the yellow and the green probe appear essentially on top of each other, and when the errors were bigger, then you can visually see that there are actually two probes, a green one and a yellow one, dancing on this gel. Now, the reasons for tracking ultrasound probe, well, it can be useful for compounding 2D ultrasound images into a volume, or to fuse ultrasound images with a pre-acquired 3D volume of MRI or CT data, for example. And if this can be done with optical tracking, of course, but those camera systems can be expensive, and they can be cumbersome to use, and they need an open line of sight for them to work. So if they could be done instead, or the same information could be found instead by simply dropping a couple of listening devices nearby, it would be a lot more convenient. So next steps. Our current prototype involves parts that are not available anymore or have been discontinued by vendors. They also include parts that were homemade. We want to make a new prototype or a beta version that will include only parts that are currently available. And along the way, we want to combine components so that they would fit in the same chassis for convenience. With a longer-term vision, we also want to, we're working with colleagues at Duke on seeing whether we might be able to make a wireless version of this device. And we want to continue nurturing collaborations that are ongoing with radiation oncology, nuclear medicine, and the National Center for Image-Guided Therapy. The first applications that we'll be pursuing are those that we consider to be lower-hanging fruit, like using OCM sensors to monitor the breathing motion during radiation therapy treatments. In top hospitals, this is done using optical tracking systems that are installed both in the simulation room and in the treatment room. But in other sites, this equipment is typically not available, and a cheap and easy-to-install OCM system could help fill that niche. Also, as mentioned before, we would like to use OCM sensors to monitor cardiac motion on high-end MR scanners. So in the first project, the first in human is expected within 12 months, and in the cardiac project, human data is already available. A PCT application was filed, and worth noting, those capsules are meant to be single-use, so they could be an important part of any future revenue stream. In conclusion, medical scanners of the future will include a large number of sensors, and machine learning will be needed to make sense of those diverse signals. Thank you for your attention.